Hi, I'm Dr. Russell Reeves. I'm one of the cardiologists with Cardiovascular Associates, and today I'm delighted to welcome the Pathophysiology students of Virginia College to our office. We're going to talk a little bit about congestive heart failure. Congestive heart failure is a syndrome where the heart doesn't pump enough blood to meet the needs of the body. That means the organs in the body doesn't get enough oxygen or blood supply, and they stimulate the kidneys to hang on to salt and water. That then causes the congestion part of congestive heart failure. Now, this congestion causes fluid to build up in the blood vessels and back up into the lungs. And it can cause shortness of breath at night when you lie down, or shortness of breath with exertion. It also causes swelling in the feet, which is edema or fluid buildup that can cause symptoms, but more importantly, is a marker of congestive heart failure. This is the exam part of our office, and here, while we're here, I was going to discuss a little bit about some of the characteristics of congestive heart failure. And I guess the primary thing I was going to talk about in this section is the different types of congestive heart failure. Because one of the types of congestive heart failure is what we call systolic, or sometimes called weak heart muscle. Now, this model shows the heart, and when you think about it, the blood flow comes back from the body to what we call the right atrium, and then it goes to the right ventricle, which is on the patient's right side of the heart, goes out to the lungs through the pulmonary artery, and then it comes back from the lungs to the left atrium, which is over here, and into the left ventricle, which is the main pumping chamber. Now, this shows one of the heart valves, called the mitral valve there. The aortic valve going out is over there. There are also two heart valves like that on the right. Well, the heart is a muscle. It's a hollow muscle, or a muscular chamber. And normally, it pumps out about 50% of the blood that it has in it. And if I model it sort of with my hands, it contracts like that. And it contracts about half of it out. Now, in patients who have congestive heart failure and weak heart muscle, the heart muscle is enlarged. You hear talk about enlargement of the heart, and it doesn't contract as well. It's weak. All right. Normal is a smaller heart that contracts like that, and a weak heart is larger, and it just doesn't contract as much. Now, the other type of congestive heart failure has a normal ejection fraction, so it contracts okay, but the heart muscle is stiff and it doesn't open up and let the blood get in it. So if the blood can't get in it, it can't pump it out. Now, the ejection fraction, the way we measure the contraction, looks about the same. The heart muscle is frequently, but not always, a little thickened, but it's a little stiff and it just doesn't pump as much blood as the body needs because of that. Now, with either of these syndromes, the kidneys respond by hanging on to salt and water, which causes the congestion that we talked about before. Now, the treatment of these are a little different. And with one of them, we have to work on lowering the blood pressure, and the other one we work on controlling fluid and the blood pressure. What we're going to talk about next is the importance of looking for the causes of congestive heart failure. We've talked about how you split it into weak heart muscle and stiff heart muscle, but particularly in some of the categories, you need to look for the underlying cause. The most common cause in this country is actually blockage in the artery, coronary atherosclerosis, or hardening of the arteries that supply blood to the heart muscle. And that can cause congestive heart failure by causing a heart attack, which cause areas of scarring and areas of heart muscle that's not going to contribute, which makes the overall heart chamber weak. Or you can have blockage of all of the coronaries so that the whole heart muscle just doesn't get enough blood supply. And if that happens, the heart muscle is weak. Now, this model shows the right coronary coming around here, the left anterior descending coming down here, and the left circumflex going around here. So we think of three arteries that supply the blood to the heart muscle. And if you get blockages, particularly in the LAD, that completely blocks it, that causes a heart attack in this part of the heart, which is one of the more important pumping parts of the heart. Now, again, that develops as cholesterol plaque buildup or atherosclerosis inside that artery. And if it gets a clot in it, it then completely closes it off and causes a heart attack. If you get just moderate plaque buildup in all of the arteries, then you get not enough blood supply to the heart muscle, and it can make the whole heart muscle weak. The importance of looking for that is that if you can find a blockage that's severe enough to cause the heart muscle to be weak before they've had a heart attack, and you reestablish the blood supply to the heart muscle, then the heart muscle gets better. If you don't find it, then you wind up just treating a patient who's got bad congestive heart failure for a long time or for however long they live, and that's difficult because treating the heart muscle when it's weak like that is difficult. All right, other causes of other causes of weak heart muscle or congestive heart failure include high blood pressure, a problem with the valves in the heart. You can imagine if one of the heart valves is leaky, then when the heart muscle contracts and pumps the blood out, it has to pump some blood to the body, but a bunch of it goes backwards through the leaky heart valve. And the heart then has to pump 2, 3, 4 times as much blood as normal just to try to get some of it to the body. Well, sooner or later, the heart muscle just gives up and gets weak, and then you develop congestive heart failure. The importance of looking for that is that if you can fix that heart valve, the patient will get better, and they'll do better over the long run. And if you don't fix it, you're again dealing with severe heart failure that's hard to control.
This person has a normal size heart. And again, this in the center is the shadow of the heart. It's the main artery, the aorta. And this is the left ventricle over here. Now, this particular person has a pacemaker, but their heart size is normal. As you can measure from this side to this side, and as you can see, that's much less than half of her chest cavity if you measure from here to over here. So this would be a normal sized heart on chest x-ray. Right. This is a chest x-ray of a person who has a markedly enlarged heart. Again, this is the right side of the heart border over here. And this is the left ventricle, the left side. As you can see here, it goes all the way out to the chest wall. So if we measure from the cross-sectional size of the heart from here to here, it's clearly much more than half of the person's chest size from here to here, so that this heart is markedly enlarged. And if you compare that mentally to the first one we showed that showed the normal heart, this heart is several times as big as that one. Now, this particular person has some fluid backing up into the lungs, but it's not bad. Now, this is a defibrillator system, and this person actually has 4 wires in the heart, with one here, one on the back of the heart here, the defibrillator wire here, one in the atrium here. And this is the actual defibrillator. Now, this defibrillator is on the front of the chest, and you can actually feel that, and in thin patients you can see it. So this is just under the subcutaneous tissue. The wires go in the blood vessels here and go around to the inside of the heart here. But we're showing this mainly to show the large heart. This is an echocardiogram of a normal person, and we're looking from the tip of the heart. This is the main pumping chamber that I just talked about. You can see the mouse moving around there. And you can see it squeezed during the contraction, or systole as we call it. All right, but if we go back and talk about our blood flow, this is the right atrium. That's where the blood's going to come to first. Right here you can see the tricuspid valve. Now, in this view, we don't see the pulmonic valve, but the blood comes to the right atrium, goes to the right ventricle, it goes to the lungs, comes back from the lungs, and it goes into the left atrium. This is the mitral valve, and you can see it opening and closing right there. And then you can see the contraction of the left ventricle afterwards. And I said, this is essentially a normal echo, and you can see how nicely the walls of the heart contract and come together. And that contraction is what we call ejection fraction, and that's the measure of how strong the heart muscle is. This is another echocardiogram, and this is of a patient who has weak heart muscle. Now again, this is the right atrium where the blood comes back from the body to the heart. This is the right ventricle, and it's actually pumping okay. You can see it's not that big, and it's squeezing okay. The left atrium, which is a little bit enlarged, where the blood comes from the lungs back to the heart after it's gotten oxygen in it. This is the mitral valve, which you can see opening and closing properly. All right, and this is the main pumping chamber of the left ventricle. And in contrast to the one we just looked at, this one is large, and it doesn't contract. The ejection fraction on this one is in the 15% range, whereas the ejection fraction on the one we just looked at is in the normal 55 to 60% range. So this is an example of congestive heart failure caused by weak heart muscle. The medical treatment revolves around several standard drugs that hospitals, in fact, are now graded on when you have somebody with congestive heart failure to be sure that you discharge patients or put patients on the appropriate medicines. Part of the medical treatment has to be diuretics to get rid of the excess fluid. Now, we sort of consider that a necessary evil because diuretics actually activate some of the body's built-in defense mechanisms that can actually worsen some of the aspects of the congestive heart failure. And then we wind up using the drugs that you see listed here to help prevent some of those. And we title that to protect the heart. An example of that type of drug is beta blockers that slow the heart rate down, they lower the blood pressure somewhat, and they protect the heart from some of the hormones that are released that stimulate the heart. The hormones are adrenaline or epinephrine. All right. The next is to control blood pressure. And the important drug class of drugs to use there is either an ACE inhibitor or an ARB. ACE inhibitor example is lisinopril. For ARBs, an example is losartan. Those drugs block the renin-angiotensin-aldosterone system and decrease some of the effect of the body's activation of some of the neuroendocrine systems that can actually, when they're overactive, can damage the heart. The last one on the list that we put is to block harmful reactions by the endocrine system, and that's done by using aldosterone inhibitors, such as spironolactone, that help get rid of some of the salt and help retain potassium in the body, because the diuretics that we listed at the top of the slide also cause you to lose potassium. Now we wanted to talk a little bit about prevention. And there's some things that cause congestive heart failure that's under our control potentially that we can prevent. And as you saw from the causes, there are many things that we can't prevent. But if you remember, one of the things I said that's most common in this country or in the developed world is atherosclerosis, which is buildup of cholesterol plaque in the walls of the artery. So how do you prevent developing atherosclerosis? And we talked a little bit about this in a previous talk, but it's preventing developing blockage. That means checking your cholesterol and getting that treated if that's abnormal. It means getting your blood pressure checked and controlling blood pressure. If you need to be on medicines, take the medicines. Most of us should probably be on a lower salt diet, then that will help over the long term control blood pressure. Another thing that predisposes to developing atherosclerosis is developing diabetes. And remember that we talked about controlling weight and a low carbohydrate diet as ways to prevent controlling diabetes. And that's why we've got the scale there. So those are some of the things that you can do that's under your control to prevent developing congestive heart failure. To recap, congestive heart failure is a syndrome where the heart doesn't pump enough blood to meet the needs of the body, and the body responds by hanging on to salt and water via the kidneys, which causes swelling or edema, fluid retention in the lungs or congestion, and shortness of breath. I hope this discussion of congestive heart failure has been informative.